Well, gosh, I'm really excited to be with this prestigious panel here of titans of the medical freedom movement. I've always had sort of a in the background position, so I've been fortunate to be working with Dr. Simone Gold since early 2021. So. I happen to be born in England, and they say in Texas that for someone like me, I wasn't born here, but I got here as soon as I could. So the same is true of America's frontline doctors. I wasn't one of the original frontline doctors, but I got there as soon as I could. I know Dr. Amling will come up to the stage shortly, but I wanted to jump right in. This is Second Opinion Uncensored, so we're going to be able to talk about, things like vaccines, maybe, and autism, and the corruption of, the medical industrial complex, as we call it. But I wanted to start with Dr. Jackson, because you told me something rather amazing this morning about treatment of autism. And I would just love to have you share that information with our audience.
Yeah, let me make sure I'm on, thanks. So actually, I got a lot of this information from Dr. Farella, who is the one that educated me. And just in a nutshell, we think about autism and we say it's a spectrum. And so as a neurosurgeon, my interest was more about the plumbing behind what happens to parts of the brain that are involved in kind of a toxic inflammatory loop. And you'll notice that, we now know that the vaccine played a large role, obviously, in that pathology. And when there are adjuvants that are metals, those metals don't break down in the system. And so in the certain part of the brain that deals with the coordination of expression and human communication, as well as motor expression, there are these small tributaries that break off. They're extremely small in a place where metals and toxins can get kind of stuck, lodged. And with that being said, when they get lodged, they can create inflammatory reactions and response that can create havoc forever. And what we've seen, and again, Dr. Farella introduced me to this, was something called True-Dose. And in a nutshell, it's basically just platelet-rich plasma. And we know in the literature, I've used it in surgery, everyone's used it for injections of the knees and so forth. But what we didn't know, and what I didn't know, was in a deeper dive of this, is that your platelets actually orchestrate, so the clumping mechanisms in your blood cells, in your blood, actually orchestrate over 1,000 metabolic reactions. Now, in medical school, I was taught that basically platelets stop bleeding. Had no idea that platelets are really super smart and they do a whole lot of things throughout your body. And so in this particular case, there's a certain way that you're able to take a child's blood and you give these platelets back over a certain amount of time, and there's an algorithm in how it works. But in a nutshell, we've done that, and I'm sure Dr. Farella has seen way more than I have, but I can tell you in my personal experience, just 3 months ago, there was a 14-year-old who was the son of a pastor, or is the son of a pastor, and he, they noted right after one of the vaccines that he just completely regressed. He stopped speaking, and it had been years. So he, grunts and one-word sentences, and he doesn't look, he's not looking at you when he's talking, when you're talking to him and so forth and so on. And so we performed this procedure called True-Dose, and on the same day that he was given this IV injection of his own blood, he began saying complete phrases just, within hours. And Dad and Mom were so shocked. They just couldn't believe it. He interacted with his family, his sister. He was just saying phrases, and it was just absolutely amazing. And And so I was just so impressed by something that's so eloquent and simple. And, God's systems in our bodies are very, very powerful. And I'm sure we'll have more dialogue on this later, but in terms of just the simplicity of the nature of what God has done in us and ways that we can be preventative and less harmful, but extremely helpful. And that was just one of my experiences in terms of a therapy for autism.
Yeah, thank you. I was just so struck by the idea of a child, perhaps at the age of 2, who became nonverbal. And I think you were describing a child that was now 10 years or more later receiving a single treatment.
Yeah.
And becoming verbal. I mean, I'm sure, normal. We're not trying to suggest that, but such a dramatic change. I practiced hospice as well as neurology were my practices. And along these lines, there were times that we had severely demented patients on hospice that perhaps had been nonverbal for 2 years. And one of the remarkable things was music therapy for those patients. Somebody would come in, play guitar, start singing a song that a family member would have told them that person knew well and loved, and the eyes would open and they would start singing the song. Someone who's not, family would be crying, looking at their loved one who had not said a word for 2 years. So.
If I could make a comment. So we were at a conference, the IANDS, and they were looking at near-death experiences, and it was fascinating. It relates directly to what you're saying in that there was one case in which there was a child who was born blind, and she drowned in the lake, and they resuscitated her, and then she began to tell them what she saw in the lake and the birds and the trees and the position of the trees around the lake, and she was 100% accurate, but she was born blind. So how was she able to describe all of those specifics without seeing? And the answer is that, I believe that, as the word says, 1 Thessalonians 5:23, that we are a spirit, and then our soul is separate from our earth suit, our body. And I believe that her spirit bypassed what was a problem with her register, her brain, to be able to see. And that was fascinating. And so, I think about, in this case with singing, same thing. Your brain is not your mind. Your brain is connected to your body. Your mind actually is connected to your spirit. And so the people singing, it's because they could bypass the processor parts of the brain that's not functioning and connect socially from a spiritual level, which is the real you. And it's so the studies of an NDE were really fascinating. You should really check them out. I think there's a documentary, Life After Death, and there's a whole discipline. But I think it really does describe our metaphysical or supernatural selves, as the Word of God says that we are who we are. And so that's what would be, just one answer, because, your processor is broken. So clearly you're bypassing hippocampus, thalamus, other midline structures that we normally use, prefrontal gyrus, use to communicate. So we're bypassing all those.
Thank you very much, Dr. Jackson. Now, you're getting a little bit into the sophisticated neuroanatomy there for the audience, but I'm sure you all know about your thalamic nuclei and your prefrontal cortex. But staying on the subject of vaccines, Dr. Farella, I'd like to turn to you. And you were telling me a little bit about your practice and that you keep some tabs on, which of the kids that I've been seeing for years and years have been vaccinated and which have not. And you've noticed some differences in health outcomes. Is that correct?
Yeah, but everyone's going to just hold up your jaw for just a minute. So prior to 2020, I was not a true skeptic of vaccines because my experience in 30 years, especially around the rotavirus vaccine, where they pulled the rotavirus vaccine in 1999, and I was in practice then. Thank you. I look very demure and young. Thank you. Appreciate that. But my job was actually to make sure all the vaccine was out of the fridges in the hospital and in the outpatient clinics. So I was walking around pulling all the vaccine if it was left in there. And I thought to myself, wow, this is really good. Like the government's paying attention, because the reason why that vaccine was pulled was for something called intussusception, which is a telescoping of the gut. It tends not to be fatal, and it was in 25 kids. So register that. Non-fatal reaction, 25 children, immediate pull of the vaccine that they suspected was the issue. Fast forward. So I really had this thing about me that said, oh, the government kind of cares about us. I was a little naive back then. But I was like, oh, okay, they're paying attention. They're paying attention to VAERS. It's something, that you heard about earlier this morning. So I said, okay, that seems okay. So I was just cautious about how I did it. They have ranges on the ACIP guidelines, so I spread things out a little differently. But here's the thing, I got to pick my own vaccine as a private practitioner that owned her own practice independently of an institution. So I always bought, and this is what I always did, I always bought preservative-free vaccine. That term means the thimerosal is not in it. And really, honestly, it wasn't because I thought the thimerosal was this horrible thing. It was because I just wanted people to have like this kind of safety that we didn't have to like fight over thimerosal. It was really, I was being lazy. I didn't want to have the conversation. But and it was an extra $1 or $2 per vaccine dose, and I was like, it's okay. I'll just do that. So I did that, not realizing that I was protecting my population. So if you look at how many kids I've vaccinated over the last 30 years, just by their statistics today, I should have over 800 autistic children in my practice. 800. I have 10, maybe. And most of those kids I can kind of tweak back like why they may have a problem. One kid I diagnosed literally at 2 weeks of age. The child never had a vaccine. And it was probably maternal medications or something that was going on with mom. Another one had COVID when he was very, very young. He's not typical. He's more like a selective mutism. Makes eye contact, very smart, great kid, just nonverbal. So, there's little things that, some genes get turned on and some genes get turned off when exposed to certain toxins. So I just didn't want that toxin in my office, so I chose not to do that. I also use a lot of supplementation in infants. So for a mom that is a C-section mom, the baby bypasses the natural way to come out, right? Comes out the wrong way, basically. So you have to give the baby probiotics because now they are sterile. So I give all of my babies born by C-section probiotics. It's my recommendation. Has been for eons. What helps your immune system? Your gut. What's in your gut? Your probiotics, right? So these are some of the things that I kind of over the years when this 2020 thing happened, I was like, I should have more autism. Why don't I have autism in my practice? And it was just from self-analysis when I'm going backwards thinking, well, what did I do different? Well, this is what I did different. Almost a great majority of my children are on fish oil. And the reason why I put them on fish oil when they're young is because one, it makes them smarter, and that's a horrible side effect. and two, like, you need it. I mean, I'm the HDL girl. I'm like, yeah, boost that HDL, come on. And it just makes kids smarter. So I think that's okay to do, right? To bypass the fishy taste, which mine does not. It's healthy AF. And
By the way, I take her fish oil too.
I'm kind of a weirdo about that. But I've been doing this for years, right? So there is a way to bypass the mechanisms, whether it's genetic, environmental, toxin, whatever, if you pay attention.
Thank you. You slipped in something called the ACIP. So that would be the Advisory Committee on Immunization Practices. Is that right?
Yes.
So
the
why don't you talk about them?
ACIP is the childhood immunization schedule. They're the ones that are in charge of that. Well, good news, one of us is on the ACIP board. It's not me, just letting you know. But we have a friendly on that board, and he's amazing. So that's, the guy is fantastic. He's an MD, PhD. His PhD was actually in myocarditis, so you can probably guess why he's on that board. But, there's a range on there. So, it's not true that you have to take all these vaccines in a big clump. A 2-month-old taking 7 vaccines, I think, is a little over the top. And so there are combination vaccines. There are vaccines that you could take apart. There's a few that you can't, like DTaP. You can't take that one apart. You can't take MMR apart in this country. So I think there's certain things, and DTaP is one of those that I personally have told people you can hold off on that. The kid's not walking, and the first question I ask is, where does tetanus come from? Anyone know? I know you do. Horses. So if you don't have a horse ranch, you don't have to really worry about it. But of course, on top of that, no one knows that. And on top of that, the Amish aren't dying of tetanus, and they live with their animals. So there's just real life observation with that. So I've spread some things out that they didn't have exactly put there. So that's why I think also is I'm not overwhelming the baby with so many immunological processes at the same time. Do I see what Paul Thomas, now some of you know who Dr. Paul Thomas is, Dr. Paul Thomas actually paid attention and had vaccinated versus unvaccinated in his practice, and he has a great disparity between his patients, and I don't. And again, I think it's just because the way we practice was different. He's from Oregon. I asked him if he had preservative-free vaccine. He said there was no such thing. But that's because some states give vaccine to their doctors, and the doctors don't have a choice and don't know about it.
Thank you, Angie. So there are 4 medical doctors on the stage right now, but there's one more enlightened practitioner on the stage, and that would be Dr. Janice Schmidt.
Amen.
Who is a naturopathic doctor. So I think maybe I'm speaking out of line, but I think for the other 4 of us, we are becoming enlightened. We are realizing that...
Enlightened, but I couldn't figure out how to turn the microphone on.
Yeah, that so much of what we have been taught in our medical career was untrue or questionable or controlled by big pharma. So, Dr. Janice Schmidt, on the subject of vaccines, what has been your approach to vaccines in your personal life? And do you see patients as a naturopathic doctor that come to you for vaccine injury, for instance?
Is that one on? It's just me.
It's her EM.
It's me, okay. It's my EMF protectors blocking it. So personally, I always had an uneasy feeling. I was a mother very young, and I was still getting my degrees and things, and I just had an uneasy feeling, so I kept putting it off and putting it off and putting it off. And as I gained more knowledge, I realized, okay, this is good. I have healthy children. Their immune systems are working perfectly, and we exposed them to all kinds of things. We traveled all over the world. They played in the dirt. Like, it was great. Their immune systems are amazing. And as time went on, I just kept saying no. And later, I was very happy I did. But when people come to me, I just give them as much information as I possibly can. It's not my decision to make that for them, but I can say, this is what I read that made me feel this way. You need to make that decision with your pediatrician, like, are you going to do this or are you not going to do this? But they need to know what each vaccine is, what's in every vaccine, and what the side effects. Like, completely informed. That's my standpoint on that, is that everyone needs to be completely informed and be ready for whatever consequences might happen. But there have been a few that say, okay, we want to do a couple of vaccines after the age of 2. So before the age of 2, there's a myelin sheath on the spinal cord that gets formed. Before that, then there's the blood-brain barrier. Things can just go right through there, right into all parts of the baby's body. So many countries don't even talk about vaccines until 2 years old. So there were some people that came to me for consult, and they wanted to do a couple, and they said, can we detox afterwards for some of the preservatives? And I said, absolutely. You can do things before, during, and after. And one of them is a homeopathic remedy called Thuja, Thuja, and it has been remarkable in helping detox. There's lots of ways to detox, but that one I've noticed for children was really effective and very easy. And then, yes, people do come with injury, and there are lots of things we can do for injury and helping get toxins out of the body. Again, there's lots of ways to do that, everything from an ionic foot bath to the sauna to different supplements and herbs that are gentle for children or adults, depending on if they're an adult. I just whispered to Dr. Farella that I got tetanus one time and totally beat it. It's like, was not a big deal. Lived on a farm and stepped on something. And sure enough, I'm like, oh, this hurts. Washed it. It was great. Next day, it was like swollen and red. I'm like, oh, do I need to look for streaks? Do I need to know where the nearest hospital is? Like, started to think about it, and this is how I beat it. This is just me, though, all right? This is not medical advice. This is just what I did. Colloidal silver. That's it. That's all I did. Topically, internally, every hour, colloidal silver for like 24 hours, completely gone. So essentially, I've had my tetanus immunization, right? Because I actually had it and beat it. So I'm sure I have those titers in my body for tetanus now. It's like, I beat it like a boss. So I try not to get too worried about it. But yes, when you know where tetanus comes from, and that's part of the education process, we're called doctors, and the Latin word for doctors literally means teacher. So we're teachers. We're teaching them the tools they need to make those decisions for their own family.
Thank you so much. Dr. Amling, welcome to the stage. I introduced you earlier, but Dr. Richard Amling.
Yeah, I didn't realize I was coming up now.
Yeah. So, Dr. Amling, we touched on a conversation this morning about Tylenol. It's in the news, and glutathione. And so on this same subject, I wonder, well, if you'd just like to, as an academic physician, I could talk a little bit about the specifics of Tylenol and how that might be an inroads to getting more exposure to, with regard to the potential harms of the vaccine schedule.
Well, let me just start by saying that I have become a pretty strong anti-vax person over the last several years. I agree with my colleague Jana Schmidt that we are born perfectly, our immune system functions perfectly, and the idea that we're somehow going to strengthen it by administering some foreign substances and adjuvants is simply just ridiculous when I think about it. But so I do think, and I'm eventually going to get to my talk on evidence-based medicine, and one of the things I was going to mention is that somehow vaccines have become exempted from the requirement to do randomized controlled trials, which is supposedly the gold standard, right? But you can't do them on vaccines, quite literally because the effect size is unmeasurable, because the diseases that they are aiming to prevent are so rare that no one is going to get them. So you cannot assess efficacy on a vaccine study with a randomized controlled trial design, but you can show harm. And that's why they are never done, because they all cause harm, because they're unavoidably unsafe, as they said early on. So that said, this issue of the acetaminophen or Tylenol, I was kind of surprised by that. I mean, I've known about acetaminophen toxicity because we used to treat patients who intentionally or unintentionally overdose with acetaminophen. And that causes fulminant liver failure and is fatal unless you treat it. And what do we treat it with? We treat it with N-acetylcysteine, which is a sort of a modified amino acid. Cysteine is one of the 3 sulfur-containing amino acids, and that is used to regenerate glutathione. Glutathione is the body's natural antioxidant. So this idea that an occasional dose of Tylenol is going to cause serious depletion of that system, I find hard to accept. Yes, a large dose or continuous intake or daily intake, I can see possibly. But just taking it for a headache here and there, I don't. I don't see that that is going to make a big contribution to autism or any kind of brain disorder. And because you can, if you just are consuming, let's say, meat has a lot of sulfur-containing amino acids, then you are going to automatically regenerate your glutathione system. And it happens like that. You don't have to worry too much about it. I mean, that's the amazing thing about the body, is that we have all these systems, and they work in the background, and we're unaware of them. But they're there to protect us, and they work. So I think that the throwing out of this acetaminophen thing was a way to show that they're actually looking at environmental causes of autism for the first time. Because before that, they're all just focused on, oh, it's genetic, it's genetic. Well, it's impossible to be genetic because our genetic structure doesn't change in one generation. It doesn't change ever, really, if you ask me. Well, it does deteriorate, but it doesn't, you don't get autism type stuff. It's too complicated. So it has to be environmental. I think vaccines are the most likely cause. There is a ton of research on it, which I've been discovering recently. So it's not like there's no, quote, no evidence. No, there's a ton of evidence that link vaccines to autism. And the aluminum adjuvants are, extremely toxic. We dealt with aluminum as a nephrologist. Aluminum accumulates in patients with kidney failure, and they would get dementia. And they would get severe osteomalacia with fractures. So aluminum is extremely toxic. And to give it to a newborn by injection, I think is, shall I say genocide? I mean, really, it is so bad.
Yeah, thank you for that. You mentioned that for some reason, randomized controlled studies are not performed on vaccines. That sort of suggested to me, yeah, it's mysterious, but it's not that mysterious, right? There agencies, there's big pharma, there's corporate interests, and they've gained control of the medical establishment, really. Do you see a way, Dr. Emling, to right that ship?
Well, by doing stuff like we are doing here, getting the word out and making people aware. The whole vaccine, in fact, all of medicine should be free of mandates. Idaho passed a law putting that into effect. I've been urging our Surgeon General in Florida, Joe Ladapo, to get behind that as well. We should have no mandates for treatment for the simple reason that mandates eliminate any possibility of voluntary informed consent, right? You're being coerced. You can't give voluntary informed consent. So we have to get rid of all mandates. If mandates for vaccines were to go away and people got informed consent, few people would take them and few people would have their kids take them. People have to be informed of this very simple fact, which Paul Thomas has documented in his great book, Vax Unvaxxed, which is that for every vaccine, the risk of death from the vaccine exceeds the risk of death from the disease it's protecting you, supposedly protecting you against. And not by a little, by a lot. So if parents know that, and they're not being forced to get their kid into school, and I do exemptions by the dozen, and they are always rejected, by the way. It's really incredible.
Mine aren't.
These people are literally, I get some through too. These people are literally the modern version of Nazis. And the people who work in these systems, who insist on poisoning kids, even after a doctor has said, no, don't do it, they insist on doing it anyway. They're taking some ridiculous list that the CDC has of acceptable contraindications to vaccination. And if you're not on that list, no, we don't look at it. That's like the Nazis. That's how they worked, right? So really, we're up against a hard place. The only thing we can do is create something new. That's what I think this is all about. And bypass it. Just make ourselves aware, resist, don't comply. When the next load of crappy mRNA vaccines come out, don't roll up your sleeve, just say no, and we'll win that way.
Understood. Very good. Thank you, Dr. Emling. So we're going to dismantle the ship, and we're going to build a number of smaller boats. And one of those boats, I think, Dr. Jackson, you were describing to me earlier today under the umbrella of PMAs. Perhaps you could touch on that for us.
Sure, thanks kindly. So it's called the Body Healthcare. It's a church. It's a ministry that is a 508c1a, and we basically position ourselves in each state through the Attorney General's office and through the Secretary of State's to let them know that we exist in each state so that we can function across borders. And in a nutshell, it's basically like a Costco, member-to-member care. And by doing that, you can supplant the covenant, the state and federal covenant, with a private covenant that's protected by the First Amendment. So that's been in place for 3 years, and we'll talk more about that fairly soon.
Very good. A question for Dr. Farella and for Jana Schmidt. As we look to try to reconfigure healthcare, I wonder whether the future of medicine is going to be an amalgam of naturopathic medicine and allopathic medicine. Do you foresee that possibility?
That's what I do every day, actually.
And that's already happening, right?
Yeah,
We're
it's
already
already
collaborating with each other all the
Yeah.
time. Yes. So yes.
I carry some stuff from Jana in my practice. I've been doing it for years.
I learned from her. So yes.
So we do, I've done everything. I can tell you years ago, people would come into my office and they're like, oh, you're that holistic pediatrician. And I was like, I don't even know what that means. Oh, you're that functional pediatrician. I'm like, sure. I had no idea because I never labeled myself. I just thought everyone did medicine the way I did. Apparently, I found out later, no one does it like the way, very few. So I've always, in my office, you can actually get these papers, because I don't have a problem killing trees sometimes, that actually have all kinds of recipes. So I give people recipes about what they can do in their own home with stuff that's easily found in their home to help their kids and to help their family. So I've been doing that for years. Some of these recipes are 30 years old, and I still use them today, every single day. So, and I go to that first. I mean, I actually am an anti-Tylenol chick. I have been forever. And it's just because I'm telling you, God put me in the right spot. I was called to be a physician. This is not a job. This was a calling, because when I was 10 years old, my brother actually drowned, and he survived. He was one of the first cold water submersion survivalists. And next to him was a little boy who died of Rye syndrome, which is the Tylenol overdose. And so I've always had a very cautious thing about Tylenol throughout my entire life, starting from when I was 10. What did I know about medicine at 10? I was 10. And so these are some of the things that, over the world, and it's funny you use the term Nazi, because my mother was also a Holocaust survivor. So the reason I'm in this fight is because drummed in my head from the time I was very young is never forget. My mother would tell me all the time, don't you ever forget, never forget, never forget. And when this stuff was starting to roll out, all I could hear is my mother's voice, because she's been gone for many years. And I kept hearing, and I'm like, thank you, Jesus, that mom is gone, because if she saw this, if she saw what our country is doing right now, she would lose it. Lose it. I mean, I already lose it for her, but she would be off the rails. So I think we just, as Americans, we're so spoiled. I tell people this all the time. My generation has not seen the horrors of what other generations have seen. And it is really important for us not to forget and to look back in our history, not rely on AI to tell us our history. I'm an anti-AI girl. And, to really teach children, put things in print. You need to put things in print. Do not rely on your cell phone to keep your lists. Things like that. You have to write with your hands. You have to write in cursive writing, because it integrates your brain. These are the things that I teach people day in and day out in my practice. How do I help my child who has a processing disorder? Do they play Legos? Do they write in cursive? Do they have one of those spirographs? Remember those spirograph things? Spirographs cure processing disorders. Could you imagine? Why are we not doing this? Mic drop.
Thank you.
Well, Dr. Atkinson, don't you think that at Gold Care, that's exactly what we're doing with the future of healthcare, right? Integrating the holistic and allopathic together?
Absolutely. I happen to have another role there at Gold Care also, but Gold Care is a place where you can see naturopathic doctors and allopathic doctors.
And not just separately. Sometimes we refer
That's
between
right.
each other too.
That's
So yeah, it's really wonderful. It's like a dream come true. It's like for a naturopath, I pinch myself like, really? This is what I've been hoping for, right? That collaboration where the person, the patient gets the best of everything.
But how about we push back on that a little bit, because absolutely an enterprise like Gold Care, Dr. Farella can communicate with you, Dr. Schmidt, and have things in her practice that broaden the scope of her practice. But we have things like the American Academy of Pediatrics, these revered, institutions putting out advisories that children should continue now to get COVID vaccines. So maybe more for Dr. Ameling, who has been a professor in academic medicine for many, many years. How do can naturopathy and allopathy truly come together? Is that ever going to happen? I mean, that would require a complete reworking of the medical curriculum.
We're doing it behind their backs. That's what we're
Can
doing.
Can it be done front and center in our medical institutions, or is that lost? Do the people just have to reject, medicine?
Probably not in our lifetime, sad to say. I mean, generally you have to wait for the old fogies in that system to die off before they can be replaced with younger people who are thinking more clearly. And I think it's our job to pass on good information, real medicine to the younger generation, because they are not getting it in medical school. I'm going to touch on that a bit in my lecture coming up, but they are being taught really awful stuff, including all the gender insanity. So we have to stay healthy and alive so we can pass on the way medicine ought to be. And naturopathy is going to be part of that for sure. But, these academic institutions are all bought and paid for by pharma. Totally. Right? There are a handful, AAPS, the American College of Pediatrics, right? With Michelle Critella's group, right?
Yeah, ACP.
ACP. The ACCP, the American College of Physicians, I used to call the American communist physicians, because these people are hard left. And, the Marxists have literally taken over academic medicine, as they have taken over all of academia.
Thank you. And I think we are getting close to the end, but Dr. Jackson, can I have you finish with making a comment on your ideas? I think you have some ideas for a future medical school. Is that correct?
So, right. Well, actually, Dr. Amerling plays a major role in that. And we have others who are poised to create a medical school that's a nice blend of naturopathic and allopathic medicine and homeopathic. And so that we can train our young folks how to be really good docs. And, we say first do no harm, right? Well, that starts with diet, and that starts with, kind of very natural ways of taking care of ourselves, right? As opposed to filling ourselves with poison. So there are pieces of those in place. And so just with funding, we believe that having a medical school and then a post-grad certification in the private sector outside of the current state and federal kind of agencies is where we're headed.
Thank you, Dr. Jackson, and thank you to all of our panel. Appreciate it.